And some words are so powerful. Words like betrayal, abandonment. We're not going to use those words against the people that we love, people who may be changing and growing as they need to.
Yeah,
if I've learned anything at 66, I'm 66 years old now. If I've learned anything, my children did not come here to walk my path. Hey, everybody, it's Dr. Jack.
And Mary.
And this is the Forbidden Doctor Podcast, episode 114, Tribal Shame and the Impact on Your Health, Part 2.
We're continuing to talk today about the tribal shame that we talked about last week, and the consciousness and the subconscious energies that are kind of laid upon us or forced upon us that we take on ourselves in order to be part of the tribe.
Especially the subconscious part.
Yeah.
And as last time, I'm telling you, I'm going to guarantee, as Mary would guarantee, that this is going to make some of you feel a little uneasy and a bit disturbed. However, here in part 2, we're going to give you the answer to the problem. And this is our job at the Forbidden Doctor, to get you to think, to ponder, to ask the questions that perhaps years of tribal influence have prevented you from doing under the pressure of the tribe.
Yeah, my daughter has her best friend. She said something one time on Facebook. There are profound things on Facebook. Yes. And I copied it, and I absolutely love it. I've quoted it for years, and this is it. There you are, playing the part that someone else assigned you, making other people's motions because you're too frightened to be still.
Wow, I think that fits in so perfect with the concept of tribal shame.
And the fear of leaving your tribe.
Yes. Okay, let's get her done.
Okay, this is this week's weekly feature, Forbidden Secrets They Don't Want You to Know. These are the secret things they keep from you, the dumb things they tell you, and the really important things they know nothing about. This is a woman who is very trusting in her tribal knowledge, as most people are.
Well, especially in a medical environment.
Yeah.
People don't read the inserts to their medication. They don't read the inserts of the injections. They just trust because that's what the tribe does. We trust people in authority.
And that's how we're leaning in this podcast and these last two podcasts, more on the medical tribe that everybody's in. And we're trying to get you to get out of your comfort zone and move into maybe another tribe of healing.
Yeah.
You can still keep the medical stuff, but we want you to move into it. But this is a very tragic story. Her name's Amy Moser. And it's a blog of hers that there are links right there that I'll have at the end of the podcast. And she says she finally wrote down what had happened to her. So.
Yeah, it's the antibiotics that she was taking.
Mm-hmm.
We're going to be talking about fluoroquinolones here for just a few moments. But she says this, I'm quoting, "The antibiotics you took or are taking for your sinus infection, UTI, skin infection, laser eye surgery, etc., may have already damaged you." And so she's talking, and we're not just pulling this out of the air. I'm going to read to you what the FDA has to say about this drug here in a moment. But Cipro, Levaquin, Avelox, nearly every generic ending in, if it's ending in quin or oxycin or ox, they're all part of a family of antibiotics that are called the fluoroquinolones.
Fluoroquinolones.
Very good.
Hard word to
say. And the FDA finally updated their warning on these antibiotics just July of last year, 2016. And they cite, quote, multiple system damage that may be irreversible.
Ooh.
Now, she says this, in 2010, I took Cipro for a UTI, and it changed my life forever.
For a UTI? A urinary tract infection.
These are extremely dangerous drugs, but they are routinely prescribed for UTI.
Yeah, I had a patient of our clinic come in yesterday. She's actually a good friend of mine. And she had a 9-day UTI, and she came in to get some products for it. And I'm so glad she didn't go on fluoroquinolone because...
Well, she says this, A round of antibiotics literally changed the path I was walking into a path I couldn't even crawl on. Multiple spontaneous tendon and ligament ruptures, spinal degeneration, and arthritis that is widespread. We're talking multiple joint dislocations and surgeries to most of my large joints and spine. 20 surgeries in the last 7 years, if you want to count. I said 20.
Wow. You know, these antibiotics are nothing like, I have a brother who's a PhD molecular biologist, and he called me one day, and I think I've told this story before, but it bears repeating. And my family is super, super medical. My tribe is super, super medical. And of course he is too. He makes drugs. That's what he does for a living. And he called me and he said, you know, he says, you know me, Mary, I'll take any drug. And he does. I mean, he says, you know, he takes drugs for his hair and his liver and his, you know, go to sleep, wake up, you know, all these different drugs. And he says, but there's one drug I won't take. And I was like, what is that? There's actually a drug you won't take.
I think he said I would never take.
Yeah. He said, I will never take an antibiotic.
Yeah.
He said, these antibiotics now are like nuclear bombs, and there's antibiotics you will never get over, which I disagree with that. And then he says there's some that, you know, will destroy you for a couple of years. But he says it's nothing like the little yeast back in the 1940s.
Yes.
The little penicillin. And that's what she's talking about here.
Yeah. This class of antibiotics, the fluoroquinolones, are supposed to be only used as a last resort antibiotic.
Not for UTIs.
No, and that's if all other options have failed. I mean, they never were supposed to be given for some common infection. And she says this, they damage the body so seriously because they actually damage the DNA mitochondrial repair cells.
Wow.
Which is, you know, it's one thing to be inflamed. It's one thing to have some tissue damage. It's another thing to stop the process of healing and repair. And she says the DNA aspect of healing and repair is destroyed, or at least negatively affected by the presence of the chemical fluoroquinolone.
And here she says, here's another sickening truth. The damage is cumulative. The more exposure you have to these antibiotics, the more damage is done to your body. Not just for some people, all people. 100% of people who take fluoroquinolone antibiotics show changes in blood flow to the tendon, cartilage, and ligaments in their bodies. Each person has a different breaking point depending on their unique DNA. Some people fall apart or die after one pill. I fell apart after my 4th round of fluoroquinolone antibiotics in my life, and some people are on their 25th round and are still oblivious to what is happening inside them until they break. It might not even be a physical one. It may be a psychotic one, but by then it's too late. The damage is done.
This is my nightmare, she says. It gets worse. There is no cure, no treatment, no relief, no specialist even. I'm telling you.
Oh, my goodness. So she says, I'm writing this in hopes that it will educate yourself and your families. Don't take that antibiotic in ignorance one more time. Don't take your chances. Don't be afraid to demand an alternative. There are alternatives if you demand them. I've refused these medications on multiple occasions. And so has my mom, who is allergic to penicillins and cephalosporins and sulfa. There are other options if you demand them. If you don't have anthrax poisoning,
which is what the fluoroquinolone was created for, was anthrax.
Or
Pseudomonas bacteria. My family doctor will tell you they can figure something else out. I'm going to share some trustworthy fluoroquinolone warning links. If you look them up, I'm sure you will be glad you did. Do it for yourself and do it for your friends and your family. And I responded. Oh, no, she goes on. Let's get a couple more things out here. This is on the Facebook post that my friend sent me. She says, over the last 7 years, I've been to 3 rheumatologists, orthopedic surgeons and spine surgeons, physical therapists, physical medicine and rehab specialists, and 3 different primary care doctors. There is no treatment but to try and put back together what breaks. I have seen multiple docs from the Mayo Clinic, and they are in the same boat as the others. They don't know how to reverse it. They can't. The science is not there yet. Well, I had a big problem with that. Sure.
And so I posted on the Facebook, as you can see on the slide. I said, what a horrible story. But we certainly have the science to fix this. She said there's no cure, no treatment, no relief, no specialist even, but that's completely wrong. She just needs to rebuild her gut microbiome with gaps. She said this might not happen to other people until the 25th dose of this antibiotic, but that would be because they had a healthier gut than she did. But it's still awful. I'm so sorry the forbidden healing information to help this sort of thing isn't more widely available. And more importantly, the information to prevent the need for antibiotics isn't at the foundation of our healthcare system. So we just keep plodding along with our Forbidden Doctor podcast and just help one starfish at a time.
Yeah, I like that. That's good.
So we come to the medical establishment for help with the symptoms of gut dysbiosis, and they further destroy our gut with antibiotics. I mean, Cipro for a UTI, so sad I have no words.
So, fluoroquinolone associated disability, and I'll tell you some of the drug by name. This was, as you see here, the FDA drug safety communication, and I'm going to quote from that here very freely here in just a moment. But they say they had a formal review of this drug to review the identification for, quote, a constellation of symptoms.
Wow.
That's associated with this. And I'm quoting from the FDA, individuals with fluoroquinolone associated dysfunction.
That's abbreviated.
Disability, excuse me.
FQAD.
Yeah, right. Are defined as U.S. patients who were reported to be previously healthy and prescribed an oral fluoroquinolone antibacterial drug for the treatment of, and these are the three things for which it's approved: uncomplicated sinusitis, bronchitis, or urinary tract infection. So there's different names. Some of these, you may not even know you've been taking a fluoroquinolone, but the associated disability with this drug is associated with Avelox, Cipro XR, Proquin XR, ciprofloxacin, which is the Proquin XR, and Factive, which is the gemifloxacin, Levaquin, and Floxin. So any one of those. Now, here's the report. In the report on the associated disability with this drug, it says a substantial disruption of a person's ability to conduct normal life functions as to a formerly healthy patient. And they describe a formerly healthy patient as, quote, able to perform all of the usual activities of daily living without significant restrictions prior to taking the fluoroquinolone. Now, the adverse reactions, tendinitis and tendon rupture.
Wow. Now,
the tendon is what attaches a muscle to the bone. So if you kind of have your hand up and you bend your arm, and right there at your elbow on the top part there, you can feel your bicep muscle coming down, and then you see the muscle come into the small little tubular, harder substance. That's the bicipital tendon. And it's attaching to the forearm, and that's what brings your hand up to your shoulder.
And because
that would rupture under the use of this drug.
The mitochondrial rupture, that's what we were talking about in the first slide. That's what happens with the tendon? I mean,
the tendon, the DNA, no, what it does is it causes the rupture because it causes a breakdown of the tissue itself. Now, you're taking it for an infection, but it doesn't just stop at the infection.
Yeah, sounds like immunotherapy to me with cancer. That's kind of the same thing. It just doesn't stop.
So these are the documented side effects of the drug: tendinitis, tendon rupture, central nervous system effects, peripheral neuropathy. I have so many patients complaining of that. I'm going to start asking them, are you taking a fluoroquinolone?
Wow.
Myasthenia gravis exacerbation. Those of you who have MG or know somebody that does, you know how terrible that is. QT prolongation. Now, I have a patient named Ron. I'm not going to say any more than that, but he's had 2 children die from a long QT. QT is part of the wave on an EKG, and there's no visible signs as to why these people died. The only thing they can figure out is on a previous heart scan, they show a long QT period of the EKG wave, and so they call it a long QT. So I'm going to, next time I see Ron, I got to say, Ron, were either of your children on a fluoroquinolone drug?
Yeah, they just died all of a sudden.
They just dropped dead.
Yeah,
they just dropped dead.
They were young. It was very, very scary.
I think they were both in their 20s. Phototoxicity, hypersensitivity, arthritis, brain fog, and anxiety. Wow. Now, I want to quote here. This is This is an actual quote published by the FDA from a meeting November 5th, 2015. And it was a meeting convened by the Food and Drug Administration Center for Drug Evaluation and Research, joint meeting of the Antimicrobial Drugs Advisory Committee and the Drug Safety and Risk Management Advisory Committee. Now, we're bringing this to you, Mary and I are, because if you're taking a fluoroquinolone, I suspect, as I'm going to talk to you about a dentist who prescribed it for me, that you probably haven't been warned of all these things before you started taking this drug. It says meeting was held at Thursday, November 5th, 2015, 8:01 a.m. to 6:05 p.m., the FDA White Oak Campus Building 31, the Great Room, White Oak Conference Center in Silver Spring, Maryland. Present were representatives of the FDA, pharmaceutical industry, and members of the general public offering testimony regarding the use of fluoroquinolone antibiotics, along with the subsequent risks and benefits of the systemic fluoroquinolone antibacterial drugs for the treatment of the diseases I've already mentioned. Presiding was Captain Monica Paris, the chairperson of the Antimicrobial Drugs Advisory Committee. And then I want to jump on down here, too, because we have the whole thing here.
It says, after lengthy testimony and discussion, the committees decided that the current labeling for these drugs was unacceptable. That's good. I'm glad they did this. But who reads these labels?
Nobody does.
Said it recommended additional study, discussion, and action to make both patient and practitioner aware of the potential for both temporary and permanent adverse reactions to the drug, particularly requiring physicians to be more completely informed that fluoroquinolones are not to be used as a first line of defense against the three maladies discussed.
That's right. And it is so used for off-label prescription, as I'm going to tell you here in a moment from my own dentist, which is, I think we can go to the
There
next.
were 476 pages of testimony.
Yes.
My goodness. Who's going to read that?
Yes. Now that you know we're not pulling this out of the air, here is on this slide all of the warnings that were a part of that meeting and the sources to get more information on this. Now, and
I'll have this at the end.
Now, I was prescribed a fluoroquinolone as early as last year from my dentist, when I had my last root canal done. Now, if you've listened to our,
root canal
podcast, you know that I've had them all removed, which is why I sound a little funny when I'm talking, because I've got a bit of a retainer in my mouth until I can have some implants. But he did the root canal, and then afterwards he said, I'm going to give you
as a matter of ordinary,
a Cipro.
Yeah.
And as a matter of ordinary antibiotic therapy, he said, here, I want you to use this fluoroquinolone. He didn't say fluoroquinolone, but Cipro, for the prevention of infection for the root canal, even though it's only recommended by the FDA for an uncomplicated sinusitis. That's an uncomplicated sinus infection, bronchitis, or UTI, none of which I had.
Wow.
So I said to him, Doc, come on, that would establish I was familiar with fluoroquinolones. And I said, that would establish a scorched earth policy, not just to my gut, but to my whole body. And he agreed. He said, yeah, but as a prevention, I recommend it anyway. And I said, well, no thanks, Doc.
Yeah.
No thanks.
Wow.
And if you've been following us in our recent podcasts, I did not use an antibiotic when I had 6 root canals removed from my mouth, all of which had infectious properties about that tooth. And as a more sensible prevention, my new dentist, Dr. Judson Wall in Bountiful, used a mixture of ozonated water, which is 8,000 times more antiseptic than a chlorine-based antibiotic, and perfectly safe for human tissue. And then as he took out the teeth and cleaned out a cavitation, he would let them bleed and bleed and bleed and bleed for several minutes, because that's part of the body's methods of cleansing a wound, is the free bleeding.
Well, that was part of the problem with my 4 cavitations, is they use that epinephrine when they took out the wisdom teeth.
Yes.
And that stopped all bleeding.
Yeah, that's a vasoconstrictor.
Yeah. So then I got the massive cavitation infections for decades I didn't know about.
Then after my wounds started to clot and the bleeding started to slow down, he would pack the wound with this mixture of my own stem cells and fibrin and platelets that they had concentrated during the surgery, because they took blood out of me to begin with. But we talk about that in the previous, just month ago. And that was 2 months ago. And to this day, I have not had the slightest infection. And my gut, I'll tell you, has thanked me a million times that I did not stick Cipro in there.
Yeah, I think that was when I was, we talked about this before, when I threw a fit and he turned, the dentist turned his back on me because I kept asking him, what would this drug do?
He pretended that you weren't in the room anymore.
It was
one of the most rude things I have ever seen.
It was almost hilarious. Yeah. And he turned his back. I said, we've spent years getting Jack's gut healthy. What is this going to do to his gut? And eventually he did say, I agree with you. It would be a scorched earth policy.
He did. Right to my face, he agreed.
But he didn't pull out the insert.
But he says that this is what we recommend.
Yeah, as a prevention. That I can't even get over that word. They're the only ones that can use the word prevention legally.
Yeah.
And they want to use a scorched earth policy to kill everything before you have the surgery.
Right.
That I still cannot wrap my head around that. You walk into a hospital, you get an antibiotic. Okay, this webinar podcast is not intended to be a diversion away from the current system of disease management. It is our intention to offer a rational and very effective approach to aiding your body in its ability to rebuild and heal. Please be advised that any suggested nutritional advice or dietary advice is not intended as any primary treatment or therapy for any disease or particular bodily symptom. Nutritional counseling, supplements/vitamin recommendations, nutritional advice, and the adjunctive schedule of nutrition is provided solely to upgrade the quality of food in the patient's diet in order to supply good nutrition, supporting the physiological and biomechanical processes of the human body. So to recap, here's these wonderful slides. We're just going to flip through them really quickly. But our ancestors endured the fight for survival in the ancient world only because they clung together and shared resources. Even today in the modern world, tribes are still absolutely essential.
Yeah, because tribes keep babies alive. They keep the old people safe. They care for the sick and the weak. In return, you get protection, nourishment, warmth to the vulnerable members of that tribe. I mean, as we're all vulnerable individuals at some point or another, but most importantly, we're part of a tribe because that tribe gives us meaning. Our tribe of origin tells us who we are.
Yeah.
Our tribe tells us what to believe. Our tribe tells us how to behave.
Here we go. This is what to believe.
This is it.
If you don't drink warm blood and eat fresh meat, you're doomed to die on the tundra.
Well, that's it. And so that's part of that tribe's rules.
There's the little kids that have to obey that.
And these rules,
which is good,
they constitute the honor code, which is the essence of any tribe. No matter what the tribe, these rules are sacred. They have to be sacred because if you didn't have those rules, then the tribe, the collective would just fall apart, and without the collective, individual people are doomed. I mean, every family is a tribe, whether they think or not, because every family has its own moral and cultural code.
Yeah, look at that cultural code.
Yeah.
Yeah.
What kind of history is in that? What kind of history were they raised with?
Yeah.
And what is that history? What do the guidelines that signal to anybody? This is how we do things around here. That's what the tribal culture boils down to. And here's a tribe that probably most of you listening to this podcast are familiar with. Some of those other tribes may seem a little distant, but they're actually tribes that are alive on the planet today. like this tribe you're looking at right now. This tribe is alive, and they have their culture, and they have their rules that simply say, this is how we do things around here.
And they look happy, and they look like everything's going great, and it may be. And yay to you if that's what's happening in your tribe.
Yes.
But sometimes it doesn't work for you.
And so this is the slide that we left you with in part 1, where we discussed the negative effects upon your body, your mind, your health because of tribal shaming. So what are we supposed to do about it? Well, you know, what are we to do, I guess is the question, when you have to combat the power of tribal shaming.
And, you know, when you want to feel free to pursue your own true path in life.
Yep.
This is about being free to be a success and by success here, we mean not only a financial success, but an emotional success. Because a person who's happy and at peace, living as he or she truly feels like they were meant to live and not necessarily how they were taught to live.
Yes.
So here in part 2, we're going to discuss the revolutionary answer.
Oh, I love what we're going to talk about. And we referred to Dr. Mario Martinez quite a bit in the previous part 1, and he spends a lot of time working with people who've left their tribes of origin or went on to exceed the expectations of the tribe, and who appear to be doing, you know, quite well in life. But they're suffering. They're suffering these consequences of reaching too high, as he says. Or doing too well in life, according to the tribal perspective.
That they feel like they've left their tribe because they're not, as we discussed in the last podcast, they're not abusive alcoholics, and they have all these tribal family telling them, you know, you think you're better than us because you've done this and this and this. So that starts to grate on you. It starts to come back to you. You start to feel like, man, I feel all this shame. I feel all this, I don't know. And so Dr. Martinez's goal is to liberate these people from the prison of shame so they can feel contented and at ease about themselves. Yeah. And he does it with an exercise with them, which you can do at home, and it's really pretty transformative.
Yeah, it goes like this, and this is from Dr. Martinez himself. You want to sit quietly in meditation, allow your mind and your breathing to settle down. Then you ask yourself this question: who is the person in the world, living or dead, who I would most need to leave behind in order to live my own true path with happiness and peace? Now that's a heavy question.
That's a big question.
This isn't like, what side of the bread am I going to butter it on?
No.
This is a very heavy question. You really have to think about it.
Yes, sit quietly and think of this.
And the answer might be shocking, but you want to allow that person's name to rise up in your mind. And just from what you've heard from Mary and I so far, there's probably already somebody's name coming up to you. And you want to be 100% honest. You want to be 100% brave. And so you ask yourself again the question, what person in my life or in my history, living or dead, would be most shocked and disappointed if I were to become a happy, peaceful, successful, prosperous soul? Really think about that.
Okay, you got the name?
Good. Now there's something you have to say aloud to that person. Don't say it aloud to the real person, of course. Because they could never handle it, and they might not even be alive anymore. But you must say these words aloud to the idea of this person.
Here's the magic words.
And here are the magic words.
I love you, but I'm going to leave you now. I have given up on myself long enough. I will no longer betray me.
The reason, as I looking at this slide myself, that these words are so powerful and radical is because they are the opposite of what we have likely spent our lives trying to prove to our tribe of origin.
Because we've probably spent our entire lives trying desperately to prove to that person you were just thinking of, or to maybe a bunch of people, that we haven't betrayed them.
Although we have in our hearts betrayed them.
Yeah, but...
And it remains unspoken. And then we start carrying all this emotional baggage around.
Because we're constantly still trying to show them that we haven't abandoned them.
Yeah.
That is really critical to us. It's instinctual.
Then we end up breaking ourselves in half or exhausting ourselves completely, maybe even bankrupting ourselves. Or giving ourselves over to some chronic disease, trying to prove that we're loyal.
And you know, I bring in here the medical establishment because I remember growing up in my very medical family, my family members talking about people that did alternative things.
Yeah.
And, you know, I don't know if they're laughing, but they were just very sad about it. I mean, they truly, truly believed, you know, you don't ever, ever, ever step out of the medical tribe. You just never do. And so we create these chronic diseases in us because we won't go out of the drugs and maybe surgery too, but the drugs that just stifle the symptoms, that don't truly heal. Because we have to prove that we're loyal.
Yeah.
And we're still part of the tribe. And that we haven't done anything wrong, and we haven't changed at all, and we will never leave you behind, and we are still one of you.
Yeah, but it doesn't work.
No, inside our hearts, it doesn't work.
Because they never really believe you. I mean, deep down inside, you know that they still consider you a traitor, don't they?
Well, yeah. I mean, here's the thing. You go out and you do something alternative, but you try and try and try. I mean, literally, you exhaust yourself trying to show them that you're still part of their tribe, but they don't believe you.
No matter what you do.
Yeah.
Because they know, and you secretly know it true, this truth, that you kind of have abandoned them.
Yeah, you already kind
You
of
have betrayed them. You did choose a totally different way of life. You have completely changed.
Because you needed to.
Yeah, you're really no longer one of them anymore.
Yeah.
Because you probably could have suffocated to death to remain trapped within that constricting tribal code. So you really have left them behind.
Because that was the only way you could become the person that your destiny called you to be. And that's all
okay.
That's all okay.
At this point, you need to become kind and gentle and tender with yourself. There's no animosity here. There's no real judgment. This is an act of love for yourself and for your truth.
This is the really radical part. When you have totally abandoned your tribe of origin, maybe, when you say those words,
yep.
I love you, I'm going to leave you now. You've abandoned your tribe of origin, and that's totally fine.
In fact, sometimes it's absolutely necessary, just as Joan of Arc was compelled to do.
Yeah, one life is all we have, and we live it as we believe in living it. But to sacrifice what you are and to live without belief, that is a fate more terrible than dying.
So, because if people never questioned or abandoned their tribes of origin, the world would never evolve.
Yeah, we would be the same forever. We would stay never changing, never moving, never anything. There'd be no creativity, no exploration, no courage, no courageous leaps of faith, no reforms, no change, no beautiful transformations.
No, just stagnancy and mediocrity. I mean, if you want to create, if you want to explore, to leap, to reform, to transform, then it's necessary sometimes to admit that you've left your tribe of origin behind. And so you must hear yourself say these powerful words out loud.
I love you, but I'm going to leave you now. I have given up on myself long enough. I will no longer betray me.
Now, that doesn't mean you don't love them.
Not at all.
You can always love them. I mean, that love always remains intact. I mean, you can even still care about the tribe. And you can,
You come for Christmas.
Yes, and look after them with acts of true generosity. None of that needs to change.
No.
This exercise is about a totally different issue from love. This is about breaking the spell of tribal change. or shame, excuse me. And we're not talking about people whose rules and tribe continues to make sense to them. I mean, some of you listening right now, you're saying, wait a second, I've got nothing wrong with my tribe.
That's great.
That's wonderful. And I'm glad you've got a beautiful, loving, nurturing, encouraging, supporting tribe. That lets you be free.
To create and change and be.
Yeah.
But that's not who we're talking to.
No. We're talking about those who have found that their own values and morals and standards and aspirations are completely different than those that have been taught to you by your tribe of origin.
Dr. McBride says the only way to break
Dr. Martinez.
Whoa, that's because I say Dr. McBride
I know,
all day long. Dr. Martinez says the only way to break that spell is to take complete ownership of your own true path.
Yes.
And to admit the consequences of leaving your tribe behind, because there will be some.
Yeah, and that major consequence is rejection by the tribe.
Yeah,
and remember, that's not safe. I mean, it goes against every instinct that you have, except for the one that's in your heart that tells you to take a different path.
Yeah. And another point, curiously, after you've done this exercise, you might feel more loving.
Oh, yes.
To those
yes.
in your tribe who tried to shame you over the years.
Yeah, when you're not dealing with the shame anymore and you can put the shame away from you, underneath all of that is the love you have for those who are in your tribe.
And you'll understand them better.
Yeah, and with that understanding, it'll be so much easier for you to regard them with a lighter heart. And then comes the next step. Aha, yes, of course, there is another step here.
You must now, in your imagination, become the other person.
Yeah, that person who's been shaming you for years, and you have to say to yourself, in the voice of the other person, you have to say these very powerful words. I completely understand, sweetheart. All I want is for you to be happy. Now, of course, it's
exceedingly unlikely that the real person will ever say those words to you. Yeah. I mean, to say that would be an abandonment of their own honor code.
But you need to say these words to yourself in their voice.
Yeah.
Yeah, you need to hold both sides of this imagined conversation according to Dr. Martinez.
You need that other person to say to you, I completely understand, sweetheart. All I want is for you to be happy.
And you may need to do this exercise with a number of people in your life.
Yeah.
And you want to be very honest. I mean, who would feel most upset and betrayed and abandoned if you were to go on a different path than they approve of? And stop. I don't want to be commanding here, but stop trying to convince them that you aren't abandoning them.
Look at this little grandma right here.
Yeah. You know, let them feel abandoned. It's okay. It's what needs to happen.
Yeah, you just say these words in your own head, and this doesn't have to be said to them, and they may not even still be alive. But look at this guy, the finger. It's always there, the finger.
Yeah, and we're not.
Look at this nice guy.
We're not advocating hurting anyone at all. Remember, they are not where you are, and they will not understand what you're doing. Also, this is not to say that you're better than anyone else, because you're not.
Yeah.
You're just on a path that more closely follows your heart.
And here's your Aunt Betty that's a nurse.
And she says, listen.
I don't have an Aunt Betty, so this isn't my family.
There's one way.
There's one way, and one way only.
Or the highway.
Yeah. One way or the highway.
Yeah, my way or the highway. Yeah.
It's scientific. It's the only way, and you don't go any other way. And then here's the other one.
Yeah, we've all felt this way one time or another, I'm sure.
With authority, yeah.
It reminds me of my principal when I was in the 6th grade. I'm serious.
Did you wear a suit to
Mr.
class?
Carlton. I didn't dress like that, and I wasn't wearing glasses, but I sure stood like that under his commanding voice a few times.
So this conversation, remember, is only in your own head. We're not advocating hurting anybody.
No.
Because they're not where you are, and they won't understand. But this is a path you have to follow.
Yeah, like I said a moment ago, it's not that you're better than anybody else. You're not. You're just on a different path.
Yeah. And this is very important, that you're able to take care of your heart like nobody else can.
Yeah.
So Dr. Martinez reports that after people have done this exercise, their cortisol levels and their stress levels drop dramatically, as do their levels of inflammation and disease.
Yeah, this is something you want to keep in mind here.
You're finally free.
Yeah. Yeah, now, and the stress that shame brings to the body raises cortisol levels that depresses the immune system, which is why people who live under that shadow so often are sick and sickly when others around them aren't. And like you said, Mary, now you're finally free. You've been carrying around this tribal shame forever, and finally, through these steps that we're pointing out here from Dr. Martinez, you can finally begin to shake it off.
Look at those people. They look so free and so happy to be living the life they want to live. But there's more.
Oh, yes.
There comes another step.
You now have to rebuild.
Sorry, I went ahead.
That's all right. You have to rebuild what Dr. Martinez calls your field of honor. Because you see, the way it works, tribal shaming, it works on you because it attacks your deepest sense of your own honor. And of course, I mean, every tribe is governed by this code of honor that it has. And once you've broken that honor code, then the tribe is going to accuse you overtly or subtly of having no honor at all.
No self-honor.
No. And that kind of an accusation is what makes you sick. Have you no honor? Do you not know who you are? Do you not know what your last name is?
Oh, yeah. I didn't raise you like that.
Yeah. I didn't raise you to do this. Who do you think you are? You think you're better than we are?
This is what makes you suffer.
That's right.
So without a code of honor,
we're going to think we're nothing. Yeah. Oh, no, my honor's been taken from me.
Yeah, worse than dirt.
The shame is more than I can bear.
Yeah, worse than dirt without self-honor.
So you have to rebuild that field of honor that Dr. Martinez talks about in order to make yourself healthy again. And how do you do this? We have an answer for you.
First, you can go listen to podcast 16, the 5-Minute Forgiveness Cure, and I think that will give you a really good foundation for accepting you for what you are and where you are.
And then here's what Dr. Martinez says you can also do. You want to do an accounting of your own life and make a list of all the times in your life that you have been honorable. And so you begin at the beginning. You start with earliest childhood memories. What was the first honorable act of your life?
Look at that little Boy Scout.
And then you go to another one where you gave a helping hand without remuneration, without accepting something back for it, without standing around to see who was looking to pat you on the back for doing a wonderful thing.
Write these down. These are things only you know that nobody else might know. When you did a random act of kindness.
Maybe you've not honored, the sacred code of honor of your tribe, but chances are you've honored something. Yeah. I mean, something that made you feel, just deep down right in your life. I mean, here, look at Atticus here. I mean, everybody who knows anything about To Kill a Mockingbird knows about Atticus Finch.
Yeah.
And there was a time in your life
that you were an Atticus
Finch and you stood up for something. Those are the things you think about to reestablish that field of honor.
These are your essential whisper.
I like that.
Yeah. That you can go back in your life and say, I felt right here.
And that's where you were on your own creative path or with your truest friendships or a choice that you made that nobody agreed with, but you were brave and you did it anyway. And or sometime when you honored your own curiosity and you stepped out of the status quo or you told the truth when it wasn't easy, or your work ethic or your health, or a time when you were very gentle, kind, and tender with yourself or a loved one, or even with your cat. Write it all down. I mean,
this is important. When you've done something terrible and you were very kind and gentle and you gave your own forgiveness to yourself, that is a beautiful loving of yourself. That is deep down right in your life when you know you can forgive yourself. You can understand yourself. And that's what I talk about, what we both do in the 5-Minute Forgiveness Cure.
Yeah. And that's where you would just focus on the true history of your own honor. It's there. You just might have to think about it for a while, like me, and write down one or two things that actually happened. And again, we would emphasize podcast 16. I mean, you can't be with honor. Honor is within you. And you just have to rebuild that field of honor because it's your defense against tribal shaming, which is always going to seek to destroy your sense of honor in order to make you weak and then bring you back home to the tribe.
Yeah. Speaking of home, here's my daughter in the middle there. She graduated. So you can just go through these different things in your life, and here's a beautiful slide. And you become the artist of your own life.
Yes.
You know there's things in your life that you did that were honorable, that felt good to you. And if it's leaving the tribe or helping somebody in the tribe or speaking up, being brave and kind.
Yeah, Cinderella says.
Yeah, here we go. Be brave and kind.
Stand up, defend yourself.
From both the living and the dead.
Yes, because the dead could be hanging around you all the time in your thoughts and your stress and your shame.
Yeah. So
when you can do that, that's when you know that you are on your true path at last.
There it is. There's
That's when you begin to feel free. And that's when you have a chance at happiness and the main thing we're talking about, deep, satisfying health.
And then there's this humbling realization when you look back on your life and you probably see times in your history where you yourself inflicted tribal shame on others.
Yes, I'm guilty.
And it makes you feel ashamed.
I am ashamed of some of the things I have said and done to other people in various tribes to keep them in the tribe because their leaving was a threat to the authenticity of the rest of us being in the tribe.
You know, I think I was kind of jealous a few times, but I remember shaming a person in our family that I felt left our tribe. And the freedom, the intelligence, the self-grounding, the self-honor, I couldn't have that. And that's,
I think back on some of, the children I feel the most sorry for are, of course, the first, second, third born.
Of our kids.
Yeah, of the kids, because they were the experiments, they were the test. And I can remember saying to my oldest son, who's now in his 40s, I can remember saying, you weren't raised like this.
Ooh.
He did something. I said, you weren't raised like this, but you know the truth? He was. Or he wouldn't have done that.
Well, I don't know. Maybe he's leaving your tribe.
But it was the threat to the honor code of the family, of the tribe, that it was a threat to. And how was I going to bring him under control but to shame him? But I didn't understand this then. And so, like Mary said, there's this humbling realization when you look back over the periods and the processes and the things that took place in your life looking for some honorable moment. You're going to, oh no, like this fellow here. Oh my gosh, I remember.
How bad is it if your child or your sibling has a beer? I mean, how horrible, truly, or is gay. I talked to that.
Well, to some families, that's the end of life. I talked to that one mother
that her son was. I talked to her for a long time. Her son had announced he was gay, and she was sobbing and sobbing and sobbing. And I said, he's going to have to leave you. He's going to have to leave your tribe. I didn't have that verbiage back then.
No, but you were right about him having to leave because of the persecution and the shame he got from his own mother.
And there's families out there that don't do that. There's families that. It's hard for them, but they accept it.
It's not that they accept the lifestyle per se, but they accept the child and the love they have for them.
That's the kind
of
tribe.
They open their arms and they say, hey, you're going to have to give us some time with this, but it does not diminish our love and respect for you.
And you can also explain the consequences of what that type of life can bring. You start drinking beer. Well, let me explain. Let me explain about, this person that it led to drugs or whatever. You don't want to hurt yourself like that, but I still love you. I mean, you can do those things. That mother walked out of that little meeting we had together and she said, well, at least I have one good son.
And we never saw her again.
Her other son wasn't gay.
Yeah. We never saw her again after that.
And so, I've done this. We've all done this.
Well, you and I have talked about this, and we've resolved to be on guard about never doing that again to anybody, and about being very careful not to use and some words are so powerful. Words like betrayal, abandonment. We're not going to use those words against the people that we love, people who may be changing and growing as they need to.
Yeah.
If I've learned anything at 66, I'm 66 years old now. If I've learned anything, my children did not come here to walk my path.
That's right.
And I tried the first, and kids, if you're listening, and I'm sorry. I did. I only did what I could do.
In the moment.
I'm in the moment, and I'm sorry.
Yeah, but
I mean, shame is a powerful dark magic. I mean, and we don't want to mess with it on either end. I mean, we're sure that you never want to hurt somebody like that, and we never want to be hurt like that again either. And you'll see people inflicting tribal shame on each other all the time, and you see people sabotaging their own lives and their own happiness in order to not betray the tribe.
So you can totally revolutionize your thinking here, because there's shaming going on everywhere.
Yeah, once you become aware of it, especially in your own life, you're going to see it everywhere you turn.
Yeah.
But now you can be free to choose your own emotional, medical, or forbidden alternative healing path, and not be stuck in the hole of just doing what the family has always done.
So you can be free to investigate, listen, and follow your own heart and your own soul. Because apparently, there's nothing that cannot happen today. I made this slide up.
I know, and every time I see this, I just love it.
I know, we had it in the last podcast, but I absolutely love it. There's nothing that cannot happen today. Something's always happened every day.
Yeah.
I don't know if it's a nuclear bomb or if it's a beautiful transformation of the soul. But there's nothing that, apparently, there's nothing that cannot happen today.
Always, by a simple act of cognition, change the path you're on. As this
the tipping point
slide here, I'm walking my own path. Your approval is not needed.
Yeah. Be brave and kind.
Not hurtful to others, but to be brave
and kind
to yourself.
Following those steps that Dr. Martinez outlined there, because remember her.
She's still in there. She's inside of you waiting. So let's go get her.
Yeah, it's so beautiful. And then remember him.
He's still in there too.
Yeah. If you wanted to be an astronaut when you were a little boy, maybe you can change your path. Maybe you can do whatever is in your heart, because desire never ends.
Yes.
Desire is always inside of you.
Because the worst loneliness is to not be comfortable with yourself. Ooh.
Yeah.
And then a poem you introduced me to.
Incongruency of soul.
From Derek Walcott, who just recently passed away a month or so ago. A beautiful poem about finding yourself when you may have had problems with the tribe or something else. And the time will come when, with elation,
this is so beautiful,
you will greet yourself arriving at your own door in your own mirror, and each will smile at the other's welcome and say, "Sit here, eat." And you will love again the stranger who was yourself. Give wine, give bread, give back your heart to itself, to the stranger who has loved you all your life, whom you ignored for another, who knows you by heart. Take down the love letters from the bookshelf, the photographs, the desperate notes, and peel your own image from the mirror. Sit, feast on your life. Ugh. Chokes me up every time I read it.
There's not much else to say. Greet yourself. Find your tribe. Love them hard.
Rarely have we done a 3-part podcast, but in doing these first 2 parts, we've stumbled across a story that would be a perfect ending to this series.
Yeah.
So we have excitedly added a part 3.
Oh, you knew it was coming.
Because more discussions needed on how to implement the leaving of your tribe. So stay tuned for next week's most incredible forbidden healing story, where a fellow left his tribe and saved his life.
And here's our disclaimer. We always have to have at the end. And if you like what we're doing in these podcasts, there's several ways to support us. You can leave a positive review on iTunes. Ask us questions, give us feedback, and at the end of this podcast, there'll be an area where you can fill in comments or questions, and we would really appreciate you doing that. And always remember, you can always join our family by filling out the symptom survey.
Yes, at forbiddendoctor.com. It's a free survey that will lead you into a free 30-minute consultation if you would like to do so.
Remember, you can always call, text, or email us with questions. We'll help you. We will see you next week with part 3 of
See you then.
Shame.
Thank you for listening to the Forbidden Doctor podcast. If you are curious about long life energy enzymes or ageless thyroid, you can purchase them without a membership from our website at forbiddendoctor.com or get our enzyme formula from amazon.com by searching the full term Long Life Energy Enzymes. Don't forget to take our obligation-free symptom survey to get a free personalized supplement protocol recommended for you by Dr. Jack, Mary, or one of our qualified nutritionists. Take the survey, get a call from our nutritionist to create a protocol and a patient login, then use that login to see your own personal protocol along with any favorites you've saved from our symptom library. Remember, our website and our clinic are here for you always.